We have learned all 206 bones in our lab. Bones join together to form a skeleton, and the connections between bones are our joints. In this class, we will talk about the joint structures, types, and the typical joints in our body. And please also review the bones in the skeleton to distinguish the bones in each joint. After this class, you should be able to distinguish the type of joints if given a specific joint, such as what type of joint the elbow is. The professional term for joint is an articulation, which is a site where two or more bones meet together. That is an articulation, or we say a joint. Since the articulation connects bones together to form the skeleton, the articulation functions to hold skeleton together, and also it gives the skeleton mobility. Every joint holds some bones together. That's how we define the joint. However, not every joint is movable. For example, the sutures. The sutures between skull bones have no mobility. We can classify the joints by their function or by their structure. So what is the joint's function again? Joint's function is to hold, here's a function, to hold skeleton and to give the skeleton mobility. Correspondingly, the functional classification is based on joint mobility here. So we divide the joints into three groups by their function based on the amount of movement the joint allows. So we can divide them to the one cannot move, and the one moves slightly, or the one moves freely. These three types all use a suffix called arthrosis. Okay. The arthrosis means joint. Okay, so what do you call the inflammation of a joint? Arthritis, right? Arthritis, that's inflammation of a joint, and the arthro part, which is the joint. So the immovable joints are thanatosis, the whole word is a thanatosis. And same for together, so the thanatosis is a joint group together. Think about our bone lab. Which bone connection are immovable? Suture, right? Suture cannot move at all, like a coronal suture between the frontal and parietal bones, and the sagittal sutures between the left and right parietal bones. They stitch up so your bones cannot move. And the slightly movable bones are amphiarthrosis. Amphi means both. Think about the amphibian, so which can live both on land and in water. Our amphiarthrosis, both movable and immovable, in fact, which means they are kind of in between, slightly movable here. They are slightly movable. For example, the joints between our rib and the sternum, they are connected by costal cartilage, and the cartilage is relatively flexible, making the joint slightly movable. That is amphiarthrosis. Amphi for both, so amphiarthrosis is both movable and immovable, something in between. Okay, so the freely movable joints are diaphosis. Diaphosis, di for complete, like in diarrhea, which means discharge completely. That's for the diarrhea meaning literally. And our elbow, knee, hip joints, those joints in our limb they are able to move freely, so they are diaphosis. So this is a functional classification of joints. By structure, we can classify joints into three groups as well. based on the material binding bones together. And sometimes we see whether there's a joint cavity, but in fact you can think the joint cavity as a unique material that binds bones together. Okay, so the fibrous joints bind bones with a fibrous, and the cartilaginous joint bind bones with a cartilage, and also the synovial joints bind bones with a synovial cavity. So it's very simple, right? You are able to tell the type of joint just by their name. But in fact, you need to know further. The fibrous joints bind bones with fibers, and there are three subtypes of fibrous joints again. So the suture, we just use it as an example for synarthrosis, the immovable joints, right? So sutures are only in skull, only can be found in skull. Okay, and they are synarthrosis by function, and by structure, they are one type of a fibrous joint. The second fibrous joint is a thin desmosis. The thin desmosis uses a longer fiber. Thin desmosis, like a fiber like this. It uses longer fibers than the one used in the suture. Okay, they connect the different bones together. And remember the word called a desmosome. The desmosome are the one type of the cell junction. They connect the cell together to prevent tearing off. The desmos, this one, and desmos here. This word part means a band. So in cellular level, our desmosome are the bands holding cell together, and in organ level, our thin desmoses are the bands holding bones together, as in this joint called inferior tibial-fibular articulation. Okay, we use the name the tibia and the fibula to form this joint's name, tibio-fibular articulation. Okay, so the last type of fibrous joints are between our teeth and the gum. The peg in socket here. The peg in socket are the type of gum forces. Gum forces, I normally remember it, the gum, G-O-M, as a G-U-M. So that remind me that this joint is in our gum. That's a gum forces. By structures, we have a fibers, cartilaginous, and the synovial joints. The cartilaginous, these joints unite bones with a cartilage. Okay, they unite bones with the cartilage directly, so there's no cavity in between two bones. For example, the costal cartilage unite our sternum and the rib together. So due to this cartilage flexibility, so our cartilaginous joints are usually movable, but only slightly movable. So in our body, we have two types of cartilaginous joint. Depends on which type of cartilage tissue connect our bones. So one is a synchondrosis, and the other is a symphysis. They are both cartilage binding joints, but they use different cartilage tissue. The synchondrosis use a hyaline cartilage to unite bones together. Like the costal cartilage bind our rib and sternum together, so during inhalation, our breath cage can expand slightly. And also when we were kid, our growth plate here, and that growth plate is made with hyaline cartilage as well, and because it connects to piece of bones, so we consider this epiphyseal plate is one type of hyaline cartilage joint as well, and that's a synchondrosis. The symphysis are fibrocartilage binding joints. You can find them in the IVD here, and also you can find them in the pubic symphysis. That's how we name this symphysis, this pubic symphysis from. It's a one symphysis. Okay, they contain strong fibers, so they can resist those compression. Again, by structure, we can classify joints into three groups based on the material binding bones together. The fibrous joints bind bones with fibers. The cartilaginous joints bind bones with cartilage. And the synovial joint here bind bones with a synovial cavity, which fill with a synovial fluid. So this fluid lubricates the synovial joint and allow the type of joints to move freely. As a result, all synovial joints are diarthrotic. So they are diarthrosis. Okay, so all the limb joints are synovial joints, and in fact, most joints in our body are synovial. Synovial joints are far more complicated and quite unique compared with other joints. So for all the synovial joints, they always have the articular capsule. It's like this. So this capsule wrap up the joint and also form a cavity inside it. This is a cavity. This is synovial cavity. So these joints also have the ligament. The ligament will bind bones together, and ligaments are the dense connective tissue, which are mostly made of tough collagen fibers, and so this ligament will just protect and pull the bone together. The ligament locate either outside the capsule, inside the capsule, or maybe even serve as a structure of the capsule as well. So they protect the cavity and pull bones together. The synovial joints also have a cavity between the bone here. Okay, so this cavity is filled with a synovial fluid, and that is very unique in the synovial joint compared to other joints as well. Okay, this fluid is named. This joint is named after this cavity, this synovial fluid. Okay, each bones in the synovial joints have their own private hyaline cartilage, and the joints is also innervated with a nerve to sense and also vascularized to receive nutrients and oxygens. So all these features are not seen in simple joints like fibers or cartilaginous joints. Some synovial joints also have a fatty pads to further protect and cushion the joint, as in our knee, inferior and deep to the kneecap, and also the baby fat, sometimes considered to be the fatty pad to protect the temporal mandible joints as well. Okay, so our knee have an interesting structure, and we call it articular disc. And also we call it menisci. Menisci is the structure here. So you can, in this picture you are looking at the tibia from the top. You can see the tibia tuberosity, this location, and two bumps, that is intercondylar eminence. So they are all here, okay, and now you know where you are looking at. So this crescent moon shape here is a pair of menisci, okay, menisci, and that is a fibrocartilage and kind of fit your femur just on top of a tibia and support the femur, and also make sure your knee can only move forward and backward, but not to the lateral and the medial side. Synovial joints are freely movable but not unconditionally free. There are three factors to stable the joints and make sure the bones are pulled together. The first one is the shape of the articular surface. Articular surface, for example, in the hip, the head of the femur fit inside the acetabulum of the pelvis, and in the elbow, the tracheal notch of the ulna hooks up the olecranon fossa of the humerus. So those are the articular surface which stable the joints. And also the bones are put together by ligament. Okay, so the more ligament you get, or the location, if they just make it more stable, so all the number and the location of the ligament will also make the joints stable. Okay, but these two factors are not strong enough to protect your joint yet. The most important one, the most important factor that stabilize your joint is muscle tone. Okay, it's a muscle, and in fact, the reason we can move your body is that each muscle binds two different bones across a joint. So every time if a muscle contract, it pulls the bones together. So every joint have a multiple muscle binding on it. So our muscle are usually passively contract to maintain our posture. So this passive contraction is called a muscle tone. Because the muscles are toned, so the muscle kind of keep on pulling your bones together passively, slightly. Okay, so that muscle tone will just make your joint more stable. And muscle bind our bones via tendons. So you see the muscle tendons, that cross joint is a very important factor to stabilize our synovial joints. So the better your muscle is toned, the stronger, the healthier your joint will be. This table is from your textbook, table 8.1, which is good summary of different joint types. I always ask you to make a chart to organize your notes as a homework. This time is the same. Please make a chart about the joint types. In fact, this table already give you the answer, but do not forget, in each type of joint, find at least one example for it. Okay, let's see a few questions here. Which of the following correctly list 3 structure types of joints? The answer is C. Fibrous, cartilaginous, and the synovia. So if you answer the B, that is a classification by function. It tells you how movable the joint is. So C is by structure, and the B, synarthrotic, diarthrotic, and amphiarthrotic, that's by functions. And amphiarthrotic joints exhibit which level of movement? The answer is B, slightly movable. Amphi for both. Amphiarthrotic can move a little bit only. Those are normally the cartilage binding ones, but if we see amphiarthrotic, we are talking about the slightly movable joints.